Welcome back to Beyond the Heart. I'm your host, Dr. Nieca Goldberg, and in this segment, we're going to be talking about low vision rehabilitation with Yupin Ju, who's Vision Rehabilitation Projects Manager at Lighthouse Guild. Welcome to the show, Yupin.
Thank you. Good morning, Nieca.
Good morning. It's great to have you. And for those who aren't familiar, what is the Lighthouse Guild?
Well, Lighthouse Guild, we are the leading organization dedicated to assessing and preventing vision loss. We provide coordinated care for eye health, vision rehab, and behavioral health, and other services directed to prevention, early detection, and intervention of vision disorders. So on top of it, we also provide online continuing education program to support other healthcare professionals, such as occupational therapists, social workers, nurses, and eye doctors who work closely with people with low vision. So the goal is to reduce the burdens of vision loss.
Right.
That's what we do here.
Okay, so let's get to the basics. What is defined as low vision?
Okay, low vision is a permanent loss of vision that cannot be improved or corrected with eyeglasses, contact lens, medicine, or surgery. It makes daily activity challenging and difficult.
And what are some of the causes of low vision in adults?
The causes could be for eye disease, such as age-related macular degeneration. That means that people were having a hard time, they lose their vision, they're difficult in reading. Or glaucoma, that means that they lose their peripheral vision, so driving or walking, crossing the street is difficult. And also people with diabetes, diabetic retinopathy, they can also affect both central and peripheral vision. And also there are other neurodiagnosis or brain injury that can also affect people with low vision.
I want to talk about the different, what is the leading cause? Is it age-related macular degeneration, the leading cause of vision loss in older adults?
Yes, people above 60, 65, the leading cause for vision loss is macular degeneration. So that means that it ends up, they were having a difficulty like in reading or writing.
Okay. And what about glaucoma?
Glaucoma also affects people, but basically they may still retain their visual acuity. That means they still read, but if they are actually getting up the stairs, getting up the ramp, or driving, they may have difficulty to see.
Wow.
Crossing the street, they may have difficulty seeing a pedestrian or seeing oncoming car.
And I know cataracts is a cause of low vision, but, are there people who don't opt for surgery?
For that, because you might have to ask our ophthalmologist. Yeah, but we do have people who require cataract, but still glaring and will become issues. You
mean even after surgery?
Yeah, for some people.
And diabetes is a big cause of problems.
Yes, diabetic retinopathy can be issues here, depending on how their sugar level, how they control their glucose, and also their lifestyle as well. So that can affect both central and peripheral. So they can actually have double whammy.
Wow. And what else? Can you talk about the misconception many have about being blind?
Yes, I think blindness is a very harsh word to use.
Sure.
When the client is being told that he or she is legally blind, it does not encourage him or to seek for help. It's very devastating when one finds he or she start to lose vision because everybody's afraid they're losing their independence. Right. So at Lighthouse Guild, we work with our clients to find out what is their potential vision. So we call it functional vision. It is not what you have lost, it is what you still got. So then we can work with you to find out what is your goal, what is important for you, because it is a quality of life that we're trying to gear toward together.
Right, and so tell me about some of the resources that you use for, to help people with low vision.
Well, before people come to us for therapy, we do have a comprehensive eye exam team. So our low vision optometrist specialists or ophthalmologists, that they will actually provide a diagnosis, and they would refer to occupational therapists, or sometimes they may need rehab teachers. Sometimes if they require the straight cane, they go to orientation and mobility specialists. And we have our social worker and our counselor work as a team for people with low vision. And when they come to rehab, then we provide intervention. We work with them how to read better, how to use magnifier better,
right,
and how to also modify their environment so it will be safer for them. So when they cook, they don't burn themselves. When they walk outside the house, they can navigate safely, so to prevent risk of fall. And we also encourage them to create more contrast. That means that if they want to have a cup of coffee, they can use like white mug, and also put over a bright color of the rug over the edge of the tub so they can see the depth, so they don't fall into the tub or trip over.
Right. I mean, I think these are all really important recommendations, and and people can get more information from Lighthouse, right?
Yes.
I'm going to welcome Tony from Nashville, who has a question. Hi, Tony. How can we help you?
Yeah. Good morning. My 97-year-old dad has had macular for 15 years. I'm 69. I'm very fit, practice good nutrition, maintain a good weight, but I struggle with good diabetes management. As of right now, I have no signs of macular degeneration or glaucoma. According to my eye physician, things look good. But I am curious as to, is this a genetic thing? Is this something that I can anticipate having to deal with if I'm fortunate enough to grow to the old age as my father is?
Yupen.
I think it's great that you are having, independence in your life and you're doing well. And sometimes people concern, okay, because my parents have that, where I have that, it may not be necessary you will end up having it. But I think it's also good to be well educated, to understand when we work with people with macular degeneration, just God forbid that you end up ever having it. It's just really, all the method, all the intervention, we can guide you, we can support you, so you can still become functional. So it's not something that, okay, if I have this, then my life is doomed. We really want to talk about like how you can better take care of yourself. Of course, definitely. Always a healthy lifestyle is the key to go. Right? Because as we age, it's like, it's like we are like an old car. We have to fix it all the time.
Right.
So we can run far and steady, but we don't have to really like race, So it's good for you that you're independent and you're in good health.
Thanks for calling in, Tony, and we're going to open up the phones for all our listeners to speak with my guest, Yupin Chu. She is a low vision rehab specialist at a low vision rehabilitation projects manager at Lighthouse Guild. And we're talking about people who have low vision and the resources that may be available to them to improve their overall quality of life. And if you have questions regarding low vision rehab or resources, give us a call at 877-NYU-DOCS. That's 877-698-3627. Or you can email us at docs@SiriusXM.com. Yupin, I want to talk about, this whole issue that of visual field deficit. What do you mean by that?
Okay, so we all have central field and also peripheral field. So central field is the field that we use to read, and our peripheral field is the field that we detect object in our environment, such as oncoming traffic and or pedestrian that pass by you. So we have the central field and the peripheral field in a simple term in that way.
Okay, and is there specific rehab for which field is involved? Why are we interested in learning about that?
Well, visual field is only part of the intervention we provide. It's because every daily task, when we read, when we cross the street, when we cook, we all require our visual field to perform the task. So in rehab, since I'm an occupational therapist, so our team and our eye doctors, that they detect what is the issues regarding the visual acuity, and how well you can see, and visual field is how you can maneuver in your environment and be safe. So we incorporate that from our doctor and to provide a treatment intervention for our client.
Okay, so it's a multifaceted program, and we'll get to that, how to get involved in the program in a little bit, but I'm going to welcome Shelley from Ontario. Hi, Shelley, how can we help you?
Yes, hello. Thank you for taking the call.
It's our pleasure.
I was listening to the previous caller who asked if any of these eye diseases is there a genetic component to the eye disease? Can a sibling inherit the disease from the parent, or is it some people as they age develop these diseases?
Yupen?
Well, because this is more on the medical component.
Let me ask the question a different way.
Okay.
Are there some conditions where you see families in your program?
Yes, occasionally. It's just because sometimes we have people bringing their parents for treatment, and then they would share with us that maybe one would have it, maybe one sibling doesn't have it, one has it, and also because the early detection, people are more aware of it. So sometimes people can live with it for their whole life and not really being aware they have it. So yes, there's a certain genetic component, but it does not say that because your parents has it, so definitely you have it.
That's right. There may be a risk, but not that you'll definitely have it.
Yeah, and from what I know is also people have to avoid smoking.
Right.
It's just like a healthy
and
lifestyle.
Exercise to improve, and diet to improve their diabetes. Yes. And lower their risk for diabetes. Yes. These are all important things. Thanks for calling in, Shelley. Yupen, I want to ask you, and Lisa from Jersey also wants to know, what exactly is involved in, low vision rehab?
Okay, so low vision rehab is a team that they provide proper diagnosis. It could be an ophthalmologist, optometrist who specialize in low vision, occupational therapist who provide a lot of interventions. So we follow the guideline from our low vision doctor. We work with our client how to use magnifier, how to improve reading speed, and how to also learn if they have this new techniques called peripheral retinal locus, which means that there's a blind spot in the eyes. People are having difficulty to read. So we try to really teach them a new skill. We call this PRL, so they can actually become more independent. And also with our rehab teachers, orientation mobility specialists, just in case people have to learn how to navigate, to walk on the street and use a straight cane. We have our social worker work closely with us, and also counselor, just to provide the support, because it is a devastating diagnosis in the sense that you feel like you're losing your sight, and people become very concerned. But really, from what we do here is we want to provide the support so people have a good quality of life to become more independent.
Right. And how do people find out about if they're interested in the Lighthouse Vision Rehab Program?
So we have a website. It's lighthouseguild.org. And we also have a 1-800 number, 1-800-284-4422. So for people who are actually in tri-state area in New York, if they can get here, then we will be happy to provide the support.
Okay, we have Joy from Virginia Beach. Hi, Joy. How can we help you?
Oh, good morning. Thank you, doctor, for taking my call.
Thanks.
I currently go to a nephrologist, have for 3 years, because I have macular degeneration. He does not give shots yet. He said he doesn't believe in it until it's needed. And I do have an aunt 95 that had all her shots, and she's 95, but now she's currently going blind because there's nothing else they can do. My question is there anything else I can do to help keep this at bay as long as possible? I am taking a vision vitamin, and I do wear sunglasses when I go outside, in the sun. And when I'm swimming and all that stuff, I keep sunglasses on. Is there anything else I can do to help this?
Well, it's great, like when people are talking about the healthy lifestyle.
Right, it is great.
Yeah, I think it's wonderful.
They're helping their eyes and their heart.
But still, it's very important is a lot of times people say, oh, there's nothing that can be done for us. It's very important, not even just us as a consumer, as you also need to educate and reach out to your doctors and explain to them that you heard of a low vision, there's a certain thing that you can do, and find out if you can reach out to an occupational therapist, to a low vision optometrist, ophthalmologist, who actually understand what is low vision. Because it's not what you have lost, it's what you can still work with it. So if you find out there's any challenge in your daily activity, like reading, writing, or even recognizing people's face, or you cannot see the food on the plate, because people told me, I do not go out to eat anymore because I eat terribly. I have food drop over myself. I can't see my friend's face. So the thing that I'm just become so aloof that I don't want to talk to them. Or even for women, they're having a hard time to put on their makeup. They couldn't see the color.
Right.
They have like a mismatched different color of clothes or shoes. And if you visit your family, if you see there's dust over in the house because they can't see. So that means that just need to give you some signals, like, hey, maybe, my family or my friend has low vision, and sometimes it's also education. You have to be yourself advocate. You have to explain to your doctor, because sometimes doctors, they are so busy, they have a lot to do, but we are able to provide the support for our doctors as well. And also, I think you just have to really educate yourself, so then you will have that continuum of care for yourself and for your family, especially if you notice that there's function. It's your daily activity that makes it more meaningful. What is important for you?
And I just want to bring up something important, because we only have about 2 minutes left, is really modifying the environment, for people who have low vision, marking objects at home. And you were talking, you talk about creating more contrast in the environment.
Yes, and also because you also want to making sure you modify environment. So if you are taking a shower, you might benefit from having a shower chair, right?
Right.
So just making sure you don't risk a chance of falling.
And also, the shower chair. But what about also lighting? Good lighting.
Good lighting. It can be also helpful, like inside the closet or underneath the cabinet of the kitchen cabinet.
Yes.
And then the other thing we also find out is that, like the iPad, the smartphone, or the high tech can also provide a lot of assistance to our client.
How is that?
Because like iPad, you can increase the contrast.
Sure.
And you can increase the font. And the smartphone, sometimes you have an accessibility feature. So a lot of our clients can actually use the smartphone and navigate the New York City street independently, because it works like a GPS.
And it talks to you.
And they talk to you. They can read back all your email. They can tell you what's the weather's like. They can read a newspaper back to you. So in a way, it's also changed people's life, the high technology.
Right, and sometimes for the better. I know there's a lot of complaints about why it's not good. But
Yes.
in this situation, it is a positive.
Yes, and also we have different apps that we also work with our clients. So when they go out to the store, the app can actually read back to you the money that you are giving out, and then also the grocery items, what you're looking at. And you can take a screenshot of the environment, and they will more or less tell you what is out there.
Well,
so the high tech also is also the other thing that are changing people with low vision as well.
And we're gonna end the segment soon, but I want to thank you, Yupin, for joining us, and we'll share the Lighthouse Guild information on our Dr. Radio Facebook page and tweet it. And I want to thank Joy for calling in. Stay with us on Dr. Radio, SiriusXM.